And our first speaker is Wim van der Brink. He's an emeritus professor in addiction psychiatry, and he was the vice chair of the MDMA State Committee in the Netherlands. And this report has actually just been submitted to the minister like 2 days ago, 1 day ago, 2 days ago. 2 days, and he will, he present the findings and the advice that they came up with. So yeah, come to the States, and the floor is yours. And I'm looking forward to hear exactly.
It's out and it's available. So I know that there's about 8 copies around here. So see what you can get. But I'll give you some places where you can find, and you can load it down, a PDF, but you can also have a hard copy when you talk to the Ministry of Health. So, very excited to be here and to talk about the report. I was asked to give a summary of the report, but that is a summary of 233 pages in 20 minutes, which is hard to do. But I'll try to do my best, and this is my disclosures. I was working with quite a lot of companies when I was still a professor of psychiatry and addiction. I was always very pleased that they could work together with the industry, because I think we can't do without, and it also shows that addiction field was still interesting to the pharmaceutical industry, where it was not so much for depression and psychosis anymore. I have 2 disclosures. One is I was once a one-day consultant with Janssen on ketamine, and I'm still a consultant for Clear Mind Medicine in Israel. What I will do, I will have a very brief history on the committee, then introduce the members of the committee, but the next speaker can do it much better, because Rick has already the nice picture of when we delivered the report to the Ministry of Health. So he will show the pictures, but I will show the names. There are 2 parts of the report. One is on recreational use of MDMA, or ecstasy, maybe better said so. And one part of the report that's on the clinical use of MDMA. So what is the history? The history is that in December 2021, there was a new government, and like in the Netherlands, it's always a coalition, and this time it was consisting of the conservative liberals, the Christian Democrats, the progressive liberals, and the social Christians. There's something different than Christian Democrats, as you might understand. And they, especially from the progressive liberals, they really wanted this report to be published, and so at the same time there was also a promise of this coalition government that there should also be a re-evaluation of the drugs on their place on the Dutch Opium Act. So on March 24, 2023, so not so long ago, this coalition asked for the State Committee with the following assignment, and this is really how it reads, and I don't know whether you understand these kind of languages. The State Commission's task is to examine the status of MDMA in the context of public health, and to advise the government on the benefits and disadvantages of the medicinal use of MDMA, including a multidisciplinary analysis of health risk prevention and the European context and relevant treaties. That was the assignment. And if you read it, we translated it for you, and it was actually examine the situation regarding public health issue of recreational use of ecstasy and advice about the medical use of MDMA. This is how we translate it, and then you come to 2 chapters of the book. So this is the committee. The committee had its activity from April 2023 till May 2024. So we worked about a year on this report. This was the committee members, and you see it's multidisciplinary. It's the chair of the committee was Brigitte Toebes. She was a professor of health law in global context, and she basically worked in her career on tobacco and prohibition of tobacco. I was the vice chair. We had an emergency physician, which was very useful in the committee. We had a professor of criminology and criminal justice, Erik Vermetten, here present, who's a professor of medical biological and psychiatric aspects of psychotrauma in the University of Leiden. And then we had Marta de Jonge, who is the coordinator of drug prevention in the Trimbos Institute. So we had a broad range of experts in the relatively small committee for the Netherlands. Only 5 people is a small committee. This is the book, Voorbij Extase, or in English, MDMA, Beyond the Ecstasy. And so, as I said, it was published a few days ago. It contains 8 chapters, 233 pages. This is the place where you can find it. You can load down the PDF. So let's go to the report first, to maybe for you at this moment the less interesting part, but still quite an important part in thinking about drug use and the position of ecstasy in the Netherlands. So this was chapter 2. It was on the prevalence, the effects and risk of ecstasy use. And the committee concluded that indeed the prevalence of ecstasy use in the Netherlands is among the highest in the world. But at the other hand, actually the frequency of use and the number of pills that is used per session is relatively low. And that's probably related also to the fact that, as far as we know, the number of ecstasy deaths compared, for example, to the UK is rather low. An interesting finding is also that of all the people who use recreationally ecstasy, there is a group of about 7%, 7% of 550,000, it's still a reasonable number, is using ecstasy, or at least tells us that they're using ecstasy to reduce their psychological and emotional problems. That's an important finding if in general people are going to say this is a medication that can work against these kind of problems. And so it might increase the prevalence of recreational ecstasy use, in theory. Other people would say, actually the market is saturated in the Netherlands, it's easily available, and there's not a lot to be expected, but we actually don't know. We also concluded as the committee, and it was mentioned last, last Wednesday in the advisory committee of the FDA, the abuse potential. Come on, that's rubbish. There is no abuse liability, there's no dependence liability. Ecstasy is used for about 35 years in the Netherlands, and we don't see ecstasy-dependent patients in our addiction treatment centers. So stop it. This is a non-addictive. There's also some discussion on the persistent cognitive deficits due to ecstasy use. And we read the literature and we talked to the main researchers in the field, and they actually, without any exception, they told us that there might be some functional fMRI findings, but actually in the clinical sense, the effects are so small that they're not clinical relevant, and these researchers, they were not particularly concerned about these cognitive deficits. There are incidents related to ecstasy. There is quite a number of, most of the time, mild ecstasy-related incidents, but it's partly dependent on the context, of course. If there is enough water available, if there are chill-out rooms, if there is a first aid services, then you can reduce the number of incidents quite dramatically, and so we clearly make it clear that this should be continued. We should take care of the users and we should do a harm reduction there. However, I think we must say, and that's the only thing that's still unclear in the Netherlands, the number of ecstasy-related fatal incidents. And that's because we don't do a lot of post-mortem evaluation, so there should be more of that, and they should also be done with taking into account the context in terms of whether was the use of any other substances, was there a lot of physical activity. All these kind of post-mortem should also be a psychological and a sociological post-mortem, not only an anatomical post-mortem. So we think that that should be improved in the Netherlands. Yeah, what do we think about Dutch drug policy in the Netherlands? Actually, we don't have a clear view of the government since 1995. That was actually a very nice vision that was formulated by the government, that there is nothing now. So actually, we're seeing all kinds of measurements, but they're placed in some kind of a clear overall vision on drug policy. But still we can say that the Dutch drug policy is primarily aimed at public health and not directed at reducing use or possession. And possession is still not prosecuted in the Netherlands. Also use is not. We also make very clear in this report that prevention should be evidence-based and never criminalize use of users. We have a development here in the Netherlands that users are being blamed for keeping the organized crime going. This is a non-evidence-based approach, and it's blaming users instead of the ones that should be blamed. And we think that the committee is clear that this is not the way to do prevention strategies. We also think that although most of the prevention activities are now paid by the cities, that and there's many different approaches to the prevention. There should be a national program, an integrated prevention program developed in the Netherlands. And the drug czar in the Netherlands has already said that he will do that. Very clearly we state that drug education should be targeted and focused on specific risks. Public campaigns are generally not advisable and can be both normalizing but also stigmatizing. So we want public campaigns to be out of the way from now on. We also think that the drug information system that is functioning in the Netherlands should be continued, and we should monitoring the epidemic of recreational ecstasy use. And finally, we should have more attention needed to foreigners that visit Dutch festivals, because we know that they are overrepresented in incidents, and we think it's mainly because they're less well educated in their countries of origin. With regard to criminality, we're in a special place, of course. We have to say that the Ministry of Health is sharing the responsibility for the drug policy with the Ministry of Justice, with a clear predominance of the Ministry of Health and also a coordinating role of the Ministry of Health. The Ministry of Justice is focused on the enforcement of the Opium Act in the Netherlands, which prohibits the possession of large quantities of MDMA and the production and traffic, but not the use of MDMA. Yeah, as we have to say, is production and trafficking are embedded in organized criminal networks, and we really have to think how we can deal with that. We also evaluated the process of the criteria to place substances in the list of the Dutch Opium Act, and we decided, based on the fact that MDMA doesn't seem to be a very dangerous substance, that it could be moved from list 1 to list 2, which is from a hard drug to a soft drug. But at the same time, that because of the organized crime situation, we think for now it should remain on list 1. We can have a debate on that. One of the reasons is that we don't think that regulating or legalizing ecstasy will immediately reduce the ecstasy production in the Netherlands. So far for the part 1. Maybe this we're not going to do now. The second part is about the clinical use of MDMA. And here I think the committee is quite clear in their statements. The committee clearly states that MDMA-assisted treatment, and you see, we don't say MDMA per se. We see it really in the context of a psychotherapeutic context. MDMA-assisted treatment seems to be effective. We say seems, but we are quite clear that we expect it to be registered in the US pretty soon. MDMA seems to be effective in the intervention of PTSD, and it is also likely to provide relief for patients that are treatment resistant, in the sense that they didn't respond to CBT, EMDR with or without the well-known pharmacotherapy. We think that in the Netherlands there are some 400,000 people with PTSD, and we also notice that a large proportion actually don't really receive good trauma treatment. And so there is a large treatment need in the Netherlands for people with PTSD. We have some experience in the Netherlands because there is a study going on in the Netherlands. So we have some experience with 8 patients treated with MDMA for PTSD in a trial. And so we have some straightforward real experience. We think that there is enough evidence, whatever the FDA may say, there is enough evidence to conclude that the MDMA-assisted treatment for PTSD within a specialized clinical setting is not only effective, but also safe, or relatively safe. There is not enough information, but that doesn't mean that you can do it tomorrow. I'll tell you later what has to be done to make that possible. The committee also says there is not enough information to make strong conclusions on the use of MDMA-assisted treatment in other psychiatric diagnoses or neurological diseases. So, but it makes clear to the government that we should take into account that if things go well with the treatment of PTSD with MDMA-assisted treatment, we should look for other treatment indications. So, we also noted that it's very unlikely that the registration dossier from the MDMA-assisted treatment will be submitted to the EMA or to the Dutch Medical Evaluation Board anytime soon to obtain market authorization for the Netherlands. So in that time, there is no standard way to use MDMA-assisted treatment in the Dutch context. So we're looking for alternative options. How can we make MDMA-assisted treatment available to patients in the Netherlands? Not within 5 or 10 years, but maybe end of this year, beginning of next year. So there are some options, and probably you know of these options. We could think of off-label use. It's not possible. There is no indication for MDMA present at this moment. So off-label use is not an option. People have said compassionate use. Now, actually, maybe in some countries it's possible, in the Netherlands not. Compassionate use you can only do if the medication is under review at the EMA or at the Dutch Medical Evaluation Board. So compassionate use is not an option for the Netherlands. Supply on physician statement, extended access strategy, as it's done in, for example, Australia or in Switzerland. It's possible, but probably not very practical. You have to make one-by-one patient requirements, and it's a lot of administrative work. So also I've heard the stories from Australia now. I think it's very courageous that they're doing, but there are many problems involved, and it's also very difficult to collect any information on what's going on in these private practices. The same is the situation in Switzerland. Very interesting, and interesting to see that the number of patients that are being treated now is exploding. But again, there was also a statement that there is not a lot of collection of data on these patients, and there is very little view. So the committee decided that the best way to go is to propose treatment of PTSD patients with MDMA-assisted therapy in the context of a large naturalistic study. And of course, we can prescribe MDMA in the context of a scientific study. It's just study medication. And so that is what we propose to the Ministry of Health, that we just start, preferably end of the year or maybe beginning of next year, a large naturalistic study in the Netherlands, paid by the Ministry of Health and maybe by insurance companies. So that is the way we're going to do. This means, by the way, whatever happens in the US with the registration, this we can do anyway, because it will be a study medication. So I hope that it will start anytime soon. And so this is maybe the most hopeful message that I have. We are very clear that it's not easy to provide this kind of treatment, so we make very clear restrictions. It should be provided by qualified therapists working in specialized treatment centers. And there is a lot to be done before we can start. We have some qualified therapists in the Netherlands. I think there are numbers like 20 to 40 available, which means that we can start. And we are very clear that everybody should be realistic in our communication. This is not a wonder pill. This is not a magic bullet. It's hard work. People get a medication, but they have to work very hard in their therapy. And also, it's not 100% success. And so it should be clearly communicated to the Netherlands. There's also, if this is going to start, we will not have the capacity immediately to treat all the hundreds, maybe thousands of patients in need of this treatment. And so there will be a big demand on the, let's say, alternative or non-regular circuit of providers. So we think that there is a lot of work to be done. One, I think the psychiatrists that are working in the Netherlands, they will be approached by various alternative treatment sectors to be helpful in indication. And I think we should develop professional guidelines how to deal with these questions by the professionals. I think there will also be an increasing number of patients that will seek MDMA-like treatment in alternative commercial circuits. We're not going to say, the committee is not saying that it should be all forbidden, but they see risks in that. And they feel that these risks should be monitored, and also that patients or people with symptoms, not just already patients, but that go to these commercial treatment centers, that if they have bad experience, there should be a hotline where they can make their complaints, so we get some view on what is going on or what's going wrong, and that maybe there should be a helpline. So there's definitely some work also for harm reduction organizations to see whether they can do something there. This is actually representing the same thing. But definitely we think that there should be strategies developed to reduce or prevent damage, hotline, helpline, and psychiatric support for those who have failures in their MDMA-assisted treatments. So this is a short summary of what the committee decided. The national drug policy should remain primarily directed to harm reduction, and the national prevention policy is effective and should not blame and stigmatize the user. MDMA is less harmful than originally thought and could be moved from list 1 to list 2. But this may hamper the fight against organized crime, and so far the committee says that for the time being it should be on list 1, being a hard drug. But they also stimulate the Dutch government to ask the WHO to make a re-evaluation. We conclude that there is a strong medical need for the treatment of chronic PTSD patients, and we think that MDMA-assisted treatment is a very promising option and should be made available to the Netherlands patients very soon and as soon as possible. And until MDMA-assisted treatment is registered in Europe, the best way to provide state-of-the-art MDMA-assisted treatment is through a large naturalistic pre-post study. And proactive action is needed to prevent harm due to illegal MDMA treatment providers. And here I end my presentation. And there is some download addresses that you can use to download the report. And I can tell you that there is an English version in preparation that will be available in probably 4 to 6 weeks. Thank you very much.
Thank you very much, Wim, for this extremely interesting presentation and this very important development. And I think it was really well timed as well with our conference to be able to present it right here, right now. We have a few minutes for questions. Let me see. A few minutes, so please line up to the mic at both sides of the room. And please enter your question with a question mark.
Yes, thank you, Wim, for the very nice presentation. I won't hold you accountable for the entire commission, but I had 2 questions. One with regard to the base rate problem of ecstasy-related deaths. How many do you think could be attributed to ecstasy? because in my opinion, I think they would be very small, the amount of related deaths. So would that actually be a problem? And why would the Commission state it as a problem? So that would be a question to elucidate. And the other question is about the problem of criminality. We had in recent years the transition from sex work to legalization. And as the Dutch government has experience with production of opioids in our history, what would be the problem of transitioning those producers of ecstasy to a legalized state?
Yeah, two very good questions. The first thing is simple to answer. We actually have not a good estimate of the number of MDMA-related or ecstasy-related deaths. The estimate right now is anywhere between 5 to 10 per year, which is much lower than in the UK, also per population, which is very small compared to some of the other drugs that we know, and especially some of the legal drugs. So it's a small number, but still, we're not saying that MDMA or ecstasy is safe. Every drug use has a risk, but this is probably a small number, and we just don't know how many of these 5 to 10 are really only related to MDMA. So we need better studies for that. The second is more difficult, the whole issue of regulation, making the production of this very good quality ecstasy that we have. I make also always the distinction between ecstasy and MDMA, because you never know what's in this, the thing that you buy on the illegal market. Generally, it's very good quality, but it can change tomorrow. Let's be fair, it can change. There was even a time that the precursors were not very well available. And we had a drop in the quality of what was called the ecstasy, but there was quite a lot of other substances in it. But it lasted for 3 months, and then the quality was completely up again. So you must say that the criminal production is very efficient in the Netherlands. Yeah, I don't know whether we have to applaud it. It's good for the users that it's not so dangerous as it could be, but it's very uncertain for the users, of course. And it would be much better if these kind of substances would be produced by a legal organization like we're producing the cannabis. So I absolutely agree with that. Now, the issue is more complex, and I didn't talk a lot about the registration, the legalization issue. It's a very complex issue, and there's pros and cons, and it's very polarized, and so we actually say that there should be a good discussion based on more scientific evidence and less on political positions. And so the committee is rather careful about that. Let's say it that way.
Thank you very much, Wim. I'm really sorry we have to wrap it up. We are really tight on time at the moment. Give a big applause to Wim again.